Welcome to the Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode. Thank you for joining another episode of the Optimal Bio podcast. Today I am joined by Kristen Davis. She is the nurse practitioner in our Charlottesville office, and we are talking about perimenopause today. So I am so excited to talk about this and provide some education on it. So thanks for being here.
Yes, my pleasure. Thank you for having me. I'm excited.
Me too. So let's start with, what is perimenopause?
Yeah, so perimenopause is a time period in a woman's life. So we have our reproductive years, and then perimenopause is a time period between the time a woman hits menopause and their regular reproductive years. And so that can be very different, the timing at least for everyone. Some women can be in perimenopause for 10 years, some women a year, some women don't feel anything until like a month. And then we have those women that I wish we could clone that never even realize they're like in menopause. They're like, oh, everything's been perfect the whole time.
Well, I need to find those. Like, study them, right? What are they doing?
Exactly. But what happens, I think to understand perimenopause, we have to have a brief understanding of the before and after, right? So we have our reproductive years. Normally what happens during that time, we have our menstrual cycle. Our menstrual cycle is a lot of different steps kind of all happening at once. So for example, the first day of your menstrual cycle is the first day that you have a bleed on women that still have a uterus. At that time, your estrogen and progesterone are very low, and they stay that way for a few days. And then some signaling from the brain starts to happen, telling our ovaries, hey, let's start getting the eggs ready. And then from there, the estrogen starts to go up. Around day 14 is when your estrogen peaks. That triggers ovulation, and the egg is released. At that time, as your estrogen is going up, your endometrial lining is also starting to thicken to get ready for pregnancy. The act of ovulation allows us to make progesterone. So there's a few cells that are released from the egg, from the act of ovulation, that allows us to make progesterone. So your progesterone will start to peak a few days after you ovulate. And if you're pregnant, it goes from there. If nothing happens, then everything starts to go back down. And then you have that time where like women experience like PMS. That's when our progesterone and estrogen levels are dropping. And then the whole cycle starts again. So that's normal. And then menopause for women, we're born with when we're born, we have like 1 to 2 million eggs, but we lose them pretty exponentially. Once you hit adolescence and puberty, you're only left with about 300 to 500,000 eggs. So that's a big loss by the time of puberty. And then every month you lose about 1,000 eggs. So 1,000 are like chosen or picked to start this cycle, but one is chosen, and that's the one that possibly can be fertilized, right? By the time you get to 30 years old, we're down to about 130-ish thousand eggs. So much less. And then by the time we reach 40, we are left with like 3% of that where we started. So it's a pretty exponential, decline in how many eggs we have. And then so menopause is when you're not ovulating anymore. There's no more eggs there. Your estrogen and progesterone drop, and you start. It's one day though. So menopause itself is just one day. That's when you've been like officially 12 months without a menstrual cycle. That's your day of menopause. After that, you're just postmenopausal. If you don't have a uterus, obviously it's hard to tell because you don't have that, but there are labs we can do to check that, and can tell us where you are in your like cycle, things like that. But that's menopause. And so perimenopause, it's going to vary for a lot of women, right? There's a lot of things that happen. There's different kind of like stages to it. So in the beginning, women might notice it's more testosterone deficiency that we start to see at first, right? So as women, we make more testosterone than we do estrogen in the body, in the ovaries. They make a lot of testosterone. That testosterone is converted into estrogen and allows that cycle and all the other things that estrogen does in our body to go. And we'll go a little bit more into that, but that's what happens normally. Well, as women, we start to lose our testosterone around age 30. So that's pretty young, right? And then also, depending on a million other things, from lifestyle to exposures to genetics, we might start losing it even before then. And so, some of the women that I get, in their early 30s or early 40s, a lot of their symptoms are just testosterone deficiency. So less motivation. I used to love to do Pilates. Now I have to drag myself there. When I'm doing it, my muscles are sore. I'm sore for days. It makes it really hard to go, right? So our muscles start to change. Our metabolism starts to change. We have no libido. Our libido starts to go down a lot. Testosterone drives our dopamine receptors in our brain, which is what helps with part of what helps with our libido. But I do hear a lot, right? Like, oh, I love my partner. I find my partner attractive, but I could care less if we ever have sex again. And that, it's not normal. Like, we want that to be it's a part of a normal, healthy relationship. So that's a lot of that is low testosterone. So that's some of the initial things we see. And then as time goes by, now, like I said, we're starting to lose a lot of eggs. The quality of those eggs also starts to change, right? And so even if you do ovulate, maybe the cells that themselves aren't as healthy, so you don't make as much progesterone. So progesterone is the first one from between estrogen and progesterone that starts to change a lot. And so we start to see lower levels of progesterone. And the way that shows up for a lot of people is just changes in sleep. So progesterone is great at allowing us to stay in that nice deep sleep and keeps us from waking up at 2, 3 in the morning for absolutely no reason. Um, the way it does that, and the reason it does that, it works on our GABA receptors. So GABA receptors in our brain are like the Xanax for our brain. That's what helps us with our anxiety, with dealing with stressful situations, right? And so those are some of the also symptoms that women start to experience. Oh, my anxiety's up. Now I'm snapping when I used to be able to just kind of hold things together and rationalize things. Because of that progesterone. And we'll get more into all the symptoms, but that's like kind of the basic for that. Because the progesterone starts to go down because of that change in cells of the ovulation. And then some women will then start to notice that their menstrual cycles start to change, where, by our 30s, we know, right? We know what's going to happen. We know when our period's going to come, how heavy it's going to be, how many pads or whatever you're going to need, all of that. But then things start to change. It's like, oh man, my periods are getting heavier, where they used to be like 3 days and maybe one of them was heavy, the other two were light. Now they're just all heavy, or they're lasting for 5 days, or you start to spot in between. Or I have women like, I get a menstrual cycle every other week. I don't know what's happening, right?
Yeah. Right? Yeah.
You add to that, now they're having all this bleeding. So now they're also anemic. So they're tired and lower energy, brain fog, all those things that also go with anemia. And so why does that happen? Well, progesterone in your uterine lining helps it with like the blood flow to it, but it also helps with like the keeping the thickness at a normal value for the time of the month. So estrogen helps your uterine lining become thicker. It promotes cell growth, all of that, which is normal. That's what we want, especially if you're planning to get pregnant. That's what you need. And so when your estrogen spikes in the middle of the month. That's when that process starts. And then the endometrial lining of your uterus becomes thicker. Progesterone goes in and helps with like the circulation of it, and then keeps it from getting too thick though. And then as the levels drop, everything goes down and then you shed. Well, if you don't have progesterone there to keep the uterine lining in check and the estrogen in check, that can become very thick. And that's when you start to see lots of clots, lots of bleeding. And then now you can start seeing changes in the estrogen levels throughout the month, where before on day 14 starting to go up and then that nice little curve down. Now it's like up and down all the time. There's nothing controlling it. Progesterone's job is to help control that estrogen, because we need it, but we don't want it to be too much in some places or too little. That's not good, right? It has to stay in whatever your body's normal balance is, and that's what progesterone does, but we lose that. And so that's what happens with like the really heavy period. So we start to see that. And then eventually the estrogen levels will start to drop. And women will start noticing that now where their periods had gotten really heavy, now they're starting to get lighter. And maybe they'll like spot for 2 days. And then that's their new norm. And they're like, oh, this is kind of nice, right? It's only 2 days of spotting. I like it. And eventually you start to skip menstrual cycles, and that's telling us that the estrogen levels are just becoming very low, and women can start having a lot more of the hot flashes, night sweats, changes like that. And then eventually you just don't make enough, and that's when we see menopause come 12 months later when you haven't had a cycle. So that's kind of the gist of all that is happening. So in our office, we see a lot of patients come in different stages, and you don't have to go through every stage. Every woman is different, like I said before. Some women will go through every single stage, and I'm so sorry.
Yeah.
I'm there with you.
Yeah.
And some women will just skip to the like certain stages, and it's all over the place. So never feel like, well, I didn't do that. Everyone's different. It depends on a lot of things, right? For example, even just when you're going to go through menopause is going to be different, right? So it can vary depending on genetics. So asking like family members is always good. Asking if your mom, when she went through menopause, how she felt, any siblings that you might have. So that can be a good guesstimate of what's going to happen with you. Your race can also make a difference. So women that have are African American can go through menopause at a younger age. Women that are have Asian descent can go through menopause later. And it can also vary depending on how many pregnancies you have. So if you're pregnant, you're not losing eggs, right? During those 9 months of pregnancy or even longer. So the more children you have, it's more likely that you're going to go through menopause a little bit later because you still have that reserve. If you've never had children and you've never been on like oral contraceptives that keep you from ovulating, then you might go through menopause a little bit earlier because you are losing those eggs every single month. Like I mentioned, oral contraceptives, they keep you from ovulating. So if you were on those for a long time, it might make it also that, you might go later. So there's a lot of things that go into it. Exposures to chemicals, toxins, traumas, all kinds of stuff will kind of throw all of that off. So everyone's a little different.
And yeah, and so yes, I love that you make sure, you said that everyone's different because, our bodies, but specifically we're talking about females today in perimenopause, even just our cycles are so different. And so just remembering not to compare, I think it's such a big thing because then you may feel like you're not normal or something's wrong with you. And it's like, no, let's see what's going on with your body and why and what you need to feel like you again, not your neighbor, not your best friend, but what's going on with your body.
Yeah, absolutely. And even with the symptoms, right? Everyone is so different. I can have someone come in with a simple, I just don't feel well, right? Like that overall feeling of unwellness, like I'm just not myself. And then I can have women that come in with every symptom, right? From I'm all of a sudden having to, my primary care is starting me on antidepressants, anti-anxiety medication, sleep aids, stimulants.
Yep. The whole trifecta, or not even trifecta, 4 or 5, whatever that is.
And it all makes sense if we look at what's happening with your hormones, right? And a lot of times with those patients, like we can help, right? Like if I give you what's missing and what's causing these changes, you don't maybe not need the medication, right? And there's a place for everything, right? If you've been on antidepressants since you were a teenager, it's not as simple, right? Like this might help if your symptoms are worsening and now you're having to add more medications because now things are changing. Obviously, it's not going to make it go away if this has been a lifelong thing, but it can add to it. But if this is something that all of a sudden, you're 45 and now they're like, well, I guess you just developed bipolar, depression, anxiety, something out of nowhere. Well, that doesn't make too much sense, right? And I see it all the time, unfortunately, because women experience like really low lows, really high highs because of all of that. That progesterone is so amazing in our brain, working on those GABA receptors, and like I said, just helps with that anxiety, helps with the sleep. If you're not sleeping well, like you're gonna feel awful, right? Like everything's gonna be off from not just how you feel mentally, your gut's going to be off. We start seeing either constipation or diarrhea or a combination. IBS can start out of nowhere if you're not sleeping. Your blood sugar is going to go up, your heart rate, your blood pressure, all of those things. That's because when we're sleeping, right, that's when your body is healing. Everything is kind of settling down, it's processing, fixing things. Normally, when you sleep, you make testosterone, which is really nice. That testosterone production helps keep your cortisol levels nice and balanced. So, cortisol, I think, gets a lot of like bad rap. And everyone's like, I don't want cortisol. It's like, no, you need cortisol.
It keeps you alive.
Yes, it keeps us alive. Without it, we die. But it has to stay in its normal little waves. So your cortisol levels is part of what helps you wake up in the morning. So they're highest in the morning and then slowly go down throughout the day. And they should be lowest when you're sleeping. Testosterone helps keep that down when you're sleeping. So they're always kind of like fighting with each other for attention. They both need cholesterol to be made. And so they're always fighting for that cholesterol to be made. And so when your testosterone is normal for us, it helps keep that cortisol down. And what does cortisol do in the body? I think it gets thrown out there, but we don't know what it does a lot of times. It helps with our energy. It helps, for example, if there's a stressful situation, right? You get a bad email. I think a lot of times we use the lion and tiger, but who sees lions and tigers unless it's
Right? Yeah.
But now our lions and tigers look like computers or cell phones or social media. And when we see those things, cortisol's job is to react, right? So if it's something that's really stressful, it increases your heart rate, increases your blood pressure to get blood flow to the brain, the vital organs that help you stay alive. And then everything that's not essential slows down, like your metabolism, your gut motility. We don't need those running, right? We just need your heart rate and blood pressure and your lungs to be at capacity to deal with this stressful situation, which is great for those situations. But when you're sleeping, we don't need those to be up, or your blood sugar, it doesn't need to be up. And so we can start seeing those changes during perimenopause. So it doesn't wait until we're in menopause. All of these changes are starting in perimenopause, right? Because of the lack of hormones. The testosterone, it helps with energy for our body, it helps with muscle. Muscle, super important, right?
Keeps you alive as well. Yep.
Absolutely. And unfortunately, we went through some years there where it was all about like being skinny, right? They didn't want curves. They didn't want muscle. Think like women, and I still hear it, right? Like, oh, well, I don't want to be all like buff. And it's like, well, just because you have testosterone doesn't mean you're going to be buff. Just like anything, just because you know how to drive a car, it doesn't make you a NASCAR driver. It's something people train for and work really hard for, right? Um, but we need that muscle. We need to keep it healthy. It's part of what drives our metabolism. It's part of what helps us keeps us upright, keeps our joints, our back from getting injured. Our heart is the most important muscle we have, our bladder. And all of those things start to change as we get older and we don't have testosterone, right? So we see slower metabolism. That's why we start to see gaining weight. We're having to work extra hard at the gym just to maintain and keep what we had. We started experiencing, frequency urgencies, more PVCs, or like it feels like the heart is pausing, but it's actually extra beats that just aren't useful. And so we start to see those. And then when estrogen goes down, same. Like estrogen is fantastic for blood flow. It helps open up our blood vessels. We have these estrogen receptors throughout our blood vessels that help them stay open, helps promote blood flow to our brain, our heart, everywhere in the body. So if you're not getting enough blood flow to certain parts of the body, they start to go down, right? So we start to see even more brain fog, difficulty focusing. Same with palpitations. It can add to that, higher blood pressure, changes in our pelvic floor, urinary symptoms, even changes like UTIs, yeast infections. I like to think of our pelvic floor as its own little self-cleaning oven. But when we don't have the tools, we don't have the healthy bacteria there and the blood flow to it, that starts to change as well, right? When we don't have the estrogen and testosterone, they both are very important for blood flow to our pelvic floor. We need them for lubrication, even sensation, right? Sensation is driven by nerves. Nerves need blood flow to them. And as that starts to decrease, women start to experience like, the sensation just isn't there. It becomes very difficult to climax, things like that, because of all of those changes that are happening. So needless to say, the range of symptoms of perimenopause are huge. And for us, our goal is to help prevent those, right? Studies have shown us that if we start in perimenopause, you have the best results, especially long term, which is at the end of the day what we want, right? We want to stay healthy. It's about quality, not necessarily quantity, but we want good quality of life in the long run that we have it. And so if we can start with, either giving you your testosterone if that's the thing that's off, right? And a lot of these we can tell by your symptoms and of course with your blood work, but we can tell, is it a testosterone issue? Is it a testosterone and progesterone? And then eventually it'll be testosterone, estrogen, and progesterone. So all of them together. Is it your thyroid? Like that also starts to slow down as we age, unfortunately. And as your hormones start to decrease, that also starts to decrease. It's part of it. They all work together. So it's a lot of symptoms that we see, but with the blood work and with your getting a good quality history from you, we can put it all together. And everything we do is very personalized, right? We don't have a one size fits all. I think sometimes there's providers that they have 3 dosages of testosterone, if any. And a lot of times male doses of testosterone that they try to guesstimate for women, right? And that's not good. We have testosterone pellets made for women so we can tailor their dose to what they need. Same thing with the estrogen. Progesterone is also playing with it. It's all about how you feel at certain levels, and that's what we try to do with everyone.
Absolutely. And, when we say, every cell in our body has a testosterone receptor, it has, 500 functions, estrogen has 400, progesterone 300. It's like, I could tell sometimes people just start glazing over, like, well, what does that mean? But specifically, we're talking about perimenopause. why you see people coming in with so many different symptoms, some very similar, but some, there could be probably 100 symptoms that have to do with perimenopause. And it's because hormones play such a key role in so many systems, so many functions in our body, that it may present differently, for different people.
Yeah. And I feel like poor progesterone, I feel like out of all the hormones, like they've all kind of been pigeonholed, but progesterone especially, it's just looked at for protection of endometrial tissue, right? Like it's just to keep you from getting endometrial cancer, and that's it. And it's like, no, that's not it. It does so much more, hundreds of function. It's so important for our nervous system. It helps with
Our bones,
neuroplasticity, protection, our bones, our mood. So,
everything.
yeah, it's a shame that they get pigeonholed, and I think a lot of it has to do with, sex hormones, right? That's
Right.
what they're named, and so understanding that they are named because when they were first discovered, they were discovered in the sex organs. But now, thankfully, we know that they're not just there; they're, like you said, everywhere. They have hundreds of functions in our body, so they're not just sex hormones; they're keep you healthy hormones for
I
everything.
know. I hope everyone just takes away sex and just their hormones. They keep you alive. They're chemical messengers. Like vitamin D is actually a hormone, but when they discovered it, they thought it was a vitamin and they just kept the name as is.
Exactly. And it's such a simple thing to help so many things, right? From making hormones like testosterone and estrogen. Vitamin D has a hand in there. It helps us make melatonin. It helps with muscle and bone health. It helps with skin. Like people that have a lot of rosacea and psoriasis, a lot of times their vitamin D is also really low. That's why, for some of those, they recommend light therapy, right? What do you get from the light therapy?
Yes.
Vitamin D.
Vitamin D. Yeah.
It helps your immune system. It helps fight cancer. It's been even used as part of cancer treatments. Like it just does so much. But again, we pigeonhole it. Oh, it's just a vitamin, even though 40% of Americans are deficient in it.
And if your vitamin D is above 60, it can prevent 10, 12 different cancers, different chronic illnesses. I'm like, why would you not?
Absolutely. And it's just, I think a lot of it is also just not knowing how it works and how to keep it balanced, right? So
Absolutely.
a lot of times with vitamin D, I think what worries people is the calcium part of it. It does affect your calcium. And so pairing it with vitamin K2 is very important, especially at higher doses, because vitamin K2 helps push that calcium that's in your bloodstream into the bones. So that way your bones stay nice and healthy, versus going to your kidneys causing kidney stones or into your arteries causing blockages, right? We don't want that. Vitamin K2 is what helps with all of that, and magnesium too. So knowing how to use them and even how to take them, right? You have to take them with fatty food. It's something that has some fat. It's fat soluble. I tell people, if you take it on an empty stomach and you don't eat, you're just wasting your money. You're literally
Absolutely.
flushing it down the toilet. So it's very, everything has its little quirks that you have to know to get the most benefit out of it. And our bodies are big quirks
Yeah.
that, it's everyone is different. So we are a lot. Sometimes people are like, well, why do I have to do labs? Well, it helps us, right? It helps us see where you're at a month after your pellet placement. Where are you there? But not only that, we talk to you, right? We're like, this is how you felt when you came in. This is how you feel now. And then we see you're going to continue to improve how you feel. So then at your appointment, the question is always, how do you feel, right? Because the numbers are only one part of the equation. You have to put it all together. So seeing how do you feel at those levels, because again, everyone's different. Where some women might feel fantastic with lower testosterone, some of us, we feel much better when our testosterone is higher, right? And it's all just depending on your body and all of those things. But It's definitely a little roller coaster that we go through. Um, and I think it's important to talk about it because for many, many years we didn't. It was kind of taboo. Or it was one of those, well, it's just part of life, suck it up and get over it. And it shouldn't, right? Like we're living so much longer, right? We're not dying in our 60s from infections anymore, in our 50s from infections or accidents. Thankfully, medicine has come a long way when it comes to that. And so now, if you go through menopause at 45, what is that it? That's the
Yeah.
end of the line. Now you're doomed to just feel horrible. And not only that, now you're like more likely to develop things like breast cancer, high blood pressure, diabetes, high cholesterol, heart disease, like all of these things. And it's like, well, why? No.
And we're living in such, much more toxic world because how women are going through perimenopause, menopause was not how women, in previous decades did because they didn't have the toxins that sped it up or made it, as bad as it is. You had mentioned in the beginning of the podcast, some like Asian culture can go through menopause much later or less severe. And so, looking at their diet or why. And so just remembering it's such bigger, or younger because of the toxins. And like you said, you don't have to suck it up. So you're going to feel horrible for the next 50 years of your life and then get heart disease and heart attacks. People don't realize the number one killer of women is heart and why, right? And it goes back to hormones. And, you did such an incredible job, showing, and the education's missing from healthcare system to for what we understand. But yes, it's not just a hot flash, just a night sweat. I feel like we hear that all the time. It's like, but what is it doing to your body right now?
Absolutely. Yeah. That we know for a fact that women that have hot flashes and night sweats, they're at higher risk of developing cardiovascular disease, right? Because think of your blood vessels. Now they're becoming basically what happens during a hot flash is they constrict, right? They become
Mm-hmm.
really tight. So they push all that blood flow, and that's what it feels like, that, that rush
Yep.
and that flushing. And then the blood vessels themselves lose their elasticity. Our body is great. It's every vessel is supposed to be really good at like opening up and closing, having that elasticity, adjusting to like positions, right? From like sitting to standing. Like you shouldn't feel like, ooh, every time you
Yeah.
stand, right? It's your body like does all of that. And we start to lose that, and that affects our heart. And unfortunately,
Yep.
the heart is so resilient, which is good. However, we don't know there's something wrong
Yep.
until it's kind of late,
Yep.
right?
Absolutely.
Like heart failure, that's a weakening of the muscle. So if we think about it, like if we're seeing that, like the muscle here, we're losing that, it's weaker. We can't do things we used to, right? Now we're tripping all the time
Mm-hmm.
and we can't recover, or we're having back sprains or strains, or shoulders,
Mm-hmm.
joints. Guess what's happening to your heart? It's
Yep.
also weakening. We just
Yep.
don't know until, like I said, it's too late. And so we want to prevent all of that from happening, right? We don't want you to wait until you're having all the night sweats, that
Yep.
you're having to sleep in a separate room from your partner because you're a
Yep.
furnace at night,
Yeah.
you're waking up drenched, right? Like that's not healthy, it's not good.
Mm-hmm.
We don't want you to wait until you have to plan your day based on bathroom availability because now you have
Yep.
urgency, incontinence, all of these things.
Yep.
We don't want you to wait until now all your labs are wonky because estrogen helps with, and testosterone with
Yep.
like liver health and keeping your liver
Yep.
healthy. The liver is what makes your cholesterol.
Mm-hmm.
And so we want a good balance there as well. We need cholesterol to survive. It does a lot, but it's all about balance, right?
Yep.
And so we don't want women to wait until everything's happening.
Mm-mm.
They have, the painful intercourse. They're having the UTIs, the yeast infections. Their marriage is almost non-existent
Mm-hmm.
because of the changes that they've experienced, right? We want to try to catch it early so that way you don't go through those. Like ideally, we don't want you to know that you went through menopause. We're just going to be like, hey,
Exactly.
guess what?
Yep.
You haven't had a menstrual cycle in 12 months. You're officially in menopause. Good. Congratulations. Or if you don't have a uterus, hey, guess what? Your FSH was like 80
Yep.
and and you'd be like, oh, I think maybe I felt one hot flash and that's it.
Exactly.
Like we want to prevent all those guys.
Absolutely, because in the U.S. we spend the most on healthcare. We're the sickest nation, and we're so reactive. And like you said, like our bodies are incredible and are so resilient. So what can we do to prevent? And I always say like I am on testosterone because for say day to day wise for energy, but then I'm like, if I could do something to protect my brain, to protect my heart, like we know women get dementia so much more than men, and there's many variables, but hormones can be a big one. So why would I not? And then I joke, I'm like, I'm never going through menopause. Like once my FSH starts rising, I might have, tiny symptoms. Give me my estrogen, give me my progesterone. But I think like women are very strong and the lack of education. So it goes back, well, I'm fine. It's okay. I could push through it. But like you said, if we're trying to push through perimenopause, menopause, all the negative things on the back end, for instance, like the number one reason why women go to a nursing home is incontinence. Or, older people die from UTIs. And it's like, wait, what? Why?
Yeah, it's so sad. Like the especially the UTI for like elderly when it can be helped by giving them vaginal estrogen, right? And I think that's a big thing that they're trying to work on because unfortunately on the like vaginal estrogen, it comes with a black box warning, right? Like it tells you it's going to cause cancer and like all these things, which it doesn't. It's a whole
Yeah.
other
Right. Yeah.
topic that can go down, but it doesn't, right? And it can prevent UTIs. And what happens with like, especially like elderly women, like I mentioned earlier, right? Your nerves need blood flow for them to give you signals, right? And so when they haven't had estrogen and testosterone for a long time to their pelvic floor, things don't feel the same. So for the elderly, they can't say, "Ooh, it burns, right? It hurts when I pee," or they can't even tell you sometimes that their bladder is full. Like those nerves aren't working the way they used to, and so by the time they have a UTI, it can get into their bloodstream or in their kidneys, and they're confused and they fall so many times elderly person comes in, specifically women or even men, but a lot of times women, and because they fell at home, do a urinalysis, sure enough they have UTI. And unfortunately a lot of times it's been so long that they've had it that they become septic and they can die from it, when it can be prevented by giving them a little bit of vaginal estrogen. It's like something so simple, but it's it's frustrating. And same for women, really. We shouldn't have to just put up with it. I was told by a patient that their GYN told them that hormones were just for reproduction, so they no longer needed those sex hormones, which infuriates me. And obviously, it's not true. Like Tyler said, testosterone has over 500 functions, estrogen 400, progesterone 300, hundreds of functions throughout our body. It's not just a sex hormone. They're not just there for reproduction. We're not just, baby producers. We're humans. We have jobs, we have families, we have hobbies, we have a whole life in front of us. And especially like I feel like 40s and 50s now, like people that have children, their children are starting to go off to college. Now they're starting to get to know their partner again, right? They've had mom and dad for many, many years. Now they're like a human again. It's like, no, we want you to have a good rest of your life, like the second half of it, right? Like we shouldn't be told like too bad. It's frustrating. But hopefully, little by little, the more we educate, the more we put it out there, more people and more providers will kind of be aware and can help others. I do have patients that are also providers, right? And so I love it because then now you know how it feels and you know the difference and you can understand your patients better, and hopefully like help them out. So, yeah.
Absolutely. I will talk to anyone and everyone about optimal bio. I'm like, I could care less if you ever come see us. Of course, I hope you do, but just giving them, like, to start thinking like there's hope for healing or other options out there. Because, like you said, and what we've talked about so many times, women are told it's normal. Oh, it's normal to feel this way. Whether you're 33-year-old because you're tired and you're a mom and you're stressed at work, or you're into perimenopause, menopause, and it's like, no, like you should feel good. You should feel good.
Mm-hmm. And that's our goal. That's what drives me every day, right? Just hearing stories from patients of how good they feel, how good their partner feels. Because a lot of times it's a joint, right? One will start and they're like, oh, I feel great. You need to match my energy now. And it's like a joint thing, right? Like, um, it's really great to see, and even like little things like, oh, I can use my hands again, right? Where I was having a lot of arthritis. Well, testosterone helps as an anti-inflammatory, and now you can use your hands again. That arthritis pain isn't there. Things are working the way they're supposed to. Your joints are better. Think like one of the common things that women will also see as they get closer to menopause is frozen shoulder filler. And it's a lack of estrogen, right? Again, blood flow. We need it.
Yes. But you'll go to an orthopedic, may get a cortisone shot, and then may go into surgery and that's why every day it's like, yes, like we want you to feel better day to day at Optimal Bio, but you talked about like that preventative care and keeping your body healthy and keeping your body moving is so important.
Absolutely. Yes. And there's things that women can do, in that perimenopause stage, not only with like hormone replacement, but just day to day, right? You, if you start being active and doing resistance training at a younger age, it will be so much better because now it becomes a lifestyle, right? It's just something that you do and honestly that you need to do to feel like good. Rather than if you wait until you're in the middle of everything, right? Like if you wait until you're in menopause and now you feel awful, you have no hormones, it's really hard to start a weightlifting routine, right? Or even Pilates, whatever that looks like for you, walking. Like you need to start early to help with that, making sure you're getting enough protein. I think for a lot of years, we didn't focus on protein for women. It was for men, right? Like
Right? Like women were supposed to have like what, 1,200 calories a day. Like it's try to, yeah.
low fat, basically nothing, just lettuce. Eat your lettuce and you'll be fine. And it's like, no. So then now we have created a whole group of women that have osteoporosis, osteopenia, because your bones, your muscles need that nourishment, right? Our muscles help keep our bones from getting injured and those joints. When you fall, right? Like if you're nothing but skin and bones and there's no muscle there, fracture goes up, right? We know after menopause, you're higher likelihood of developing osteopenia and osteoporosis, but it doesn't start at menopause. It starts with perimenopause when we're having those shifts, it can start at 30 when you've lost your testosterone, right? If you don't have any testosterone, it's hard for your body to make those cells that make bone. And so now you can't make bone. Your bone's always building up and breaking down. That's our body's amazing, but it needs the tools to do it. And unfortunately, we start losing them pretty young. So, yeah.
Absolutely. And that's the thing with, you know, environmental factors causing our testosterone decrease much quicker. Then it's a cascade effect, with the rest of our hormones.
All those xenoestrogens or fake estrogens, like I mentioned before, right? Your testosterone is turned into estrogen via aromatase. That's normal. your brain loves estrogen. That's what drives your brain, right? However, if you have a lot of these fake estrogens, like you can get from our food, right? Pesticides, PVC pipes, plastics, all kinds of chemicals out there. They look like estrogen, and the brain can't really tell the difference between your natural estradiol or those fake estrogens. So the brain is like, whoa, I have a lot of estrogen. What can I do? So the brain's like, well, I'm going to tell the ovaries or the testes, whatever, to make less testosterone so that way we can decrease the estrogen we have in our body. And we see that, right? Like we see that even in younger and younger people, right? Little girls start bleeding at younger age, not necessarily ovulating, but they have these big surges of estrogen, which again makes the uterine lining become thicker, and they can start to experience bleeding at a younger age or even ovulating. And they start to have issues with their menstrual cycles, things like that. In boys, we start to see like low muscle mass, depression, anxiety, all the typical, low testosterone symptoms like depression, anxiety, low libido. It's like, why am I seeing 20-year-olds with ED? It's wild, but it's all those like fake chemicals. And unfortunately for a younger population, they're born into it. So it really is a lot to try to work on that, right? And when you're young, you don't think about any of that. So it's up to us to try to educate them and try to help our families where we can, right? Like by removing um, scented candles, scented products, all the super flowery smells and everything that is in everything.
And I always say, I'm like, the easiest thing to do for your health, throw out anything with fragrance, or do not buy scented trash bags, Febreze, like Glade plugins, anything. Just like get rid of fragrances because they're everywhere.
They really are. And I honestly try to not to think about it too much, because I'm like, all my clothes, I just need to burn them.
Right? You can start going crazy.
Carpet, like anything that's fire retardant, like all of these things, it's a lot. So do what you can, right? Like try not to drink from plastic water bottles. If you get coffee, switch it to a glass container. Like try not to drink, the paper plastic cups, they're lined with all that stuff. Trying to eat whole foods, things like that. All of those things are very important for our hormones and the hormones of our whole family. So making it a lifestyle as much as possible rather than just a fad.
Exactly, like little by little. It's like, don't go and try to do everything in one day, because we want it. Yeah, it needs to be a lifestyle and normal, because not adding more stress to your life. And if you do it little by little, then you start feeling better. Your family starts feeling better. And then you understanding the why. You're not just not buying a fragrance trash bag. It's like, oh, how am I feeling day to day? How is it affecting my body to keep me healthy?
Yeah, so it's a lot, but little by little, and we try to help with little nuggets of information every time a patient comes in. Try to, give a little extra nugget to help them through their journey, because that's all it is, right? It's a journey that we hopefully can go through together and make it as easy as possible.
Absolutely. And yeah, medicine, wellness is a journey. And yeah, you and the rest of the providers at Optimal Bio provide such great education. And that's the thing, it's just continues to learn that education and being able to share it.
Absolutely. It's our pleasure.
Yes. Well, thank you. This was great. Like we could talk for the next 4 hours about hormones, perimenopause, women. I'm like, now we need to go back to talk about postpartum, right? There's so many things we can talk about.
So many. But it was a pleasure. Thank you.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brandon, Medical Director Greg Brandon, podcast host Tyler Brandon. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.